Welcome to the Pediatric Brain Tumor Foundation's webinar, Navigating Anticipatory Grief with Children. My name is Jen Kelly, and I'm the Family Support Manager for the Pediatric Brain Tumor Foundation. Thank you for joining us today for this important subject. Before we get started, I have a few guidelines to review. You are muted for this webinar and your video is disabled, but we welcome questions during and after opening remarks. Please type your questions into the Q&A feature found at the bottom of the Zoom window. We will not get to every question, but we'll try to answer as many as possible. Our presenter for today's webinar is Dr. Megan Schaefer, a pediatric psychologist in hematology, oncology, bone marrow transplant, chronic pain, and palliative care at Nationwide Children's Hospital and an assistant professor in the Department of Clinical Pediatrics at The Ohio State University in Columbus, Ohio. She specializes in providing psychosocial care to children and families impacted by serious illness, with a particular focus on the pediatric neuro-oncology population. Dr. Schaefer completed her graduate training in the clinical psychology at Auburn University, her internship at Nationwide Children's Hospital, and her fellowship at St. Jude Children's Research Hospital. Her clinical and research interests primarily include meaning-making, legacy-making, grief, bereavement, and sibling adjustment to a childhood cancer diagnosis. Dr. Schaefer currently serves as the co-chair of the Palliative Care and End-of-Life Special Interest Group within the Society of Pediatric Psychology. She also previously participated as a member of the leadership board on the Sibling Partnership for Advocacy, Research, and Care in Childhood Cancer, or SPARC. Lastly, Dr. Schaefer volunteers as a member of the Central Ohio Grief Care Coalition and serves on the Medical Advisory Board and Psychosocial Care Committee of Flying Horse Farms, a camp dedicated to supporting children and families impacted by serious illness. It gives me great pleasure to introduce Dr. Megan Schaefer.
Thank you for that introduction, Jen. Can you all hear me okay? Because it just gave me a message that I'm on mute.
We can hear you.
Okay, perfect. So as Jen said, the title of my presentation today will be called Navigating Anticipatory Grief with Children. Next. So in today's presentation, the main objectives I have is 1, to define anticipatory grief in relation to the pediatric brain tumor journey. 2, to discuss anticipatory grief responses in parents and caregivers, patients, and siblings. And 3, to provide strategies to help family members navigate anticipatory grief when facing a child's end of life. Next. So to start off with, let's define what anticipatory grief is. So oftentimes the most common definition you'll see among the literature is that it's the mourning of a loss that has not yet happened. And I think that most of us are familiar when we think about grief. The most common thing that we think about is when someone we love dies or when our pet has died. But oftentimes we talk much less about the grief that families experience at the time of the cancer diagnosis. And so I really like how in some of the literature, they talk about anticipatory grief as a cumulus loss effect over time. And essentially what that is at the moment of diagnosis, families and patients will start to experience many losses. So that might be the child loses their hair, they may not be able to go to school, they don't get to do their hobbies and interests, family roles change. And all of these are simply losses that start to build up and add up over time. And because of this, the pressure of all the different types of losses that come along, that can be very overwhelming with families, on top of having the cancer diagnosis where there is the significant fear and the threat that is posed that their child may not survive their illness. Next. So what does anticipatory grief look like and feel like for patients and families? So oftentimes we hear from families about the shock. I think we hear this especially for a lot of families. If they're receiving a diagnosis that is incurable, it's hard to even process information in the moment. Obviously, with grief comes sadness, depressed mood, and anger is a big one that we often feel as well. And this can be anger for a variety of things. It might be sometimes feeling anger about the child getting sick. Sometimes parents and siblings will talk about being angry with a child because they're taking up a lot of time or requiring a lot of care, which kind of goes into the guilt that they may feel It might be anger at a higher power for not being able to save the child's life or even to present them with this diagnosis in general. Relief, I think that's when we think about this with guilt, sometimes these goes hand in hand of having mixed emotions that come along with anticipatory grief. So on the guilt hand, I think a lot of people are experiencing worries about their child being sick and how that will progress, but they might feel guilt because of how exhausting the journey is, wanting their child to be in a better place, to no longer be in pain, or feeling upset about the duties that come along with being a caregiver, or feeling like they weren't able to save their child. And with that, with the mixed emotions, sometimes when a child dies, parents will say they feel a little bit of relief because their child is no longer in pain. And then again, I think that further results in some guilt that they experience because of experiencing some relief. Resentment, that's a big one that often comes up with our siblings, especially if they feel like the division of time between the child who is sick and themselves, that there's not a lot of time that they get with their parents. And so they might start to resent losing out on special time with their parents. Loneliness, isolation, tiring, oftentimes this denial, right? One not wanting to recognize or acknowledge this really challenging diagnosis and the impact it might have on their quality of life. And then in the third column, you see a lot of the typical physiological symptoms when we think about grief when families are bereaved. So difficulties with sleep, you may lose part of your appetite, you may overeat in response to all of the stress, you might feel nauseous or fatigued, all things that we know that happened when your body is experiencing significant stress. And then one I would really like to highlight as well is disengagement. And for all the healthcare providers on this call, I feel like this is a really important one that we want to monitor when we're caring for our families, especially in anticipatory grief. Sometimes we might see that siblings and parents might kind of leave before their child left, essentially. And what I mean by that is seeing the child who is sick is facing that threat to their child's life, and it reminds them of this impending threat and what that could mean. And so to protect themselves from that, they may start to withdraw. So in a parent, that might look like not being as involved in caregiving, or as a sibling, maybe they start playing less with the sibling as well, because again, facing that causes more stress. And so what we really want to do is monitor that so that we can help support them, facilitating that positive family time together. Next. So I think one thing that's important to talk about is how anticipatory grief can differ from conventional grief, because as you all can imagine, parents and children are at very different parts of the illness journey when they're experiencing one versus the other. So one key difference is this idea of balancing between holding on and letting go. When you're in the bereavement stage, in the sense that the patient has died, let go of that physical presence. But before the child died, you are in this, it's kind of like a tug of war of you're holding on and you're hoping for the best and you're hoping for as much time and the best quality of life as possible, while also preparing yourself for what is to come or what could potentially come for the child. And as you all can imagine, that is exhausting day in and out, and probably even smaller increments of time than days, right? Minute by minute, where you're really involved in the minute, you're enjoying the moment, and then all of a sudden you are overwhelmed by the fear that tomorrow could be your child's last day. In regards to hope, a lot of our families will talk about this hope of wanting their child to live a long life with cancer, and again, to the best quality of life as possible, and hoping for a miracle. And what we know for all of our families, that miracle can look a lot of different ways, right? That can be a miracle for one more day. It can be a miracle that the child lives to graduate high school, a miracle that they're able to go on their Disney World trip. And so I think, and again, that balance of what hope looks like and how we support families in experiencing that, but that is something that is unique when the child is still alive, of kind of reformulating hope as they go throughout the journey. And then, as I mentioned before, because anticipatory grief is not talked a lot about a lot of our families talk about feeling more loneliness, isolation, and feeling misunderstood. So when we think about bereavement for families, oftentimes there's marked rituals, right? People might have celebrations of life, they might have funerals, but there's things that people do. Families go over and they bring food and they visit. But in anticipatory grief, unless you've walked a journey like this, sometimes people don't really give that word grief. So all of these emotions and the roller coasters that families are experiencing, they don't always have the name for it, which is why I feel like it's so powerful that we talk about it. Because if we give a name to what families are experiencing, I think it helps society know what these families need to best support them and help them hopefully not feel as misunderstood, and that there's ways that we can support them throughout the active treatment journey. Next. So in terms of phases of anticipatory grief, these are not like linear phases or that they go one after another. They may not experience all of these, but these are some phases that we hear from patients and families as they go along throughout this process. So one is that realization that death is inevitable. So when we're thinking about the patient and siblings, the developmental differences in understanding death, we know that our younger kids tend to not recognize that death is inevitable. But for even a lot of us, sometimes unless we're presented with that threat, it might not be something that we think a lot about, or if we haven't had exposure to a loved one dying. And when you're faced with this, it becomes a little bit more real. Families will also start to talk about the concern for the child who is dying. I think a lot of times we hear from parents, like, I wonder what Joe is thinking about when he sits here in the clinic appointments, or I wonder if he's scared, or what kind of questions are coming to his mind. And then also that concern of like, did I do everything right? Was it because, for siblings, was it because I yelled at him and told him to go away? And that's why he has this now. So we start to kind of think about all of the physical and emotional consequences that families are experiencing during this. Rehearsal of actual death. This is a big one that comes up in anticipatory grief. And I have a quote later that I think describes this quite nicely. A lot of parents will often talk about, as they're processing this information about these difficult diagnoses, in their mind, they may be imagining walking through their child's funeral line, or what it would be like to plan their child's funeral or to bury their child. And it's almost like they're in that imaginary phase and trying to prepare themselves. But as you can imagine, that would be really distressing. And then what life will be like following the child's death. So for parents, it's, who am I if this child dies? Am I still a parent if this is their only child? Or for a sibling, like trying to find their place in the family, and it's the missed prom and missed high school graduation and college and being a grandparent, all of those things that they start to envision as future losses. Next. And for all of our families on the call, and for providers as well, we know that the trajectory of serious illness is quite different for all family, but I think really the best way to always describe this is it is a true emotional roller coaster. So from time of diagnosis and hearing the shocking news, and I always talk about with families, no matter what the prognosis is, we would all be lying if we said that when a family hears the word cancer, one of the first things that they are always going to think about most likely is death, because that's what a lot of us have associated cancer with. And so again, putting a word to it and talking about it and giving a name to this grief experiences that families have when they first hear about their child's diagnosis. Things might be a little steady for a while, their child may go into remission. Then you have your ongoing surveillance scans. There might be uncertainty with scans. Then you might experience a relapse. The child has acute declines. Then the parents and children are going through, is the child going to die? To more of the confirmation, if prognosis is poor, we are going to lose our child. And then just as this picture shows, so many loops, ups and downs as they try to navigate each of these steps, which, as we've talked about, is emotionally and physically exhausting. Next. So what does anticipatory grief specifically look like for our pediatric neuro-oncology population? Some of these things we've already talked about a little bit when we were talking about it generically. One of the ones that I often hear, especially in neuro-oncology, is this idea of the body betraying the child. I've heard a lot of kids talk about almost like their body is like a foreign, unrecognizable object. And a lot of times when we think about pediatric neuro-oncology diagnoses, they can significantly change the appearance of the child. They can change their functioning, right? So difficulties talking, swallowing, weakness, being able to move their extremities, all of those things are quite stressful. And so they feel like their personality and they are the same person inside, but they're trapped inside all of the changes that their illness has unfairly forced on them. Similarly, that change in identity, like looking in the mirror every day and noticing how different I look, or hearing parents say of like, out of all the changes that they've lost, at least could their physical appearance still look the same? And going through changes, both not only what the child can do, but how the child looks like. And it feels like there is no escape from all of the things that cancer has unfortunately faced on their life. Independence, I especially think about this for our adolescents and young adults. This is a time where independence is super important. And so as their illness progresses, they may require help from their parents to help eat, bathe, like all of those activities of assisted daily living. And that's extremely frustrating, especially at that developmental age. Ability to complete projects and plans. So we know that all kids, they have lots of big dreams, and there's careers that they want to do. There's places they want to travel to. There's family goals that they have. And these are things that they share with their parents as they grow up. And so as families kind of have that understanding that again is threatened, depending on how this illness proceeds, can be quite scary for families. And then changes in relationships. I think that's a big one for a lot of our siblings. Of sometimes, again, with that disengagement piece, they may start to play less with their brother or sister, or maybe feel like they have to pick up extra chores or take care of the younger siblings. And then parents and their role too, how they're shifting their identity of taking care of the child who is ill while also still being a parent to siblings. Next. One of the things for anticipatory grief that I often hear from families is how much more complicated this can feel when a family that they were closely connected with when a patient has died. And I believe when they talk about it, it's struck a different chord for them, right? And it's that reminder of, okay, so this close friend that we had has died. Like, when is that going to happen to my child? And then those worries kind of escalate. And I think especially for our children who are in those positions of having the diagnosis, just the fear of, will they be the next one on the unit that is not able to survive their illness. And then oftentimes we talk a lot about balancing emotional energy and how that's exacerbated by caregiver burnout. So in all of these difficult journeys, parents and families are investing significant emotional energy in balancing all of the things that come along with this. So this can be things related to caregiving, right? Which we know, again, can be very physically and emotionally draining. This can be trying to focus on living in the present and enjoying the moments. And while that is what all families want to do, we know it's not easy to do when you're feeling really stressed and the world is still existing outside. There's bills to be paid. There's jobs that need to be completed. There's transportation and school and all the things that life presents at us. And so it really just becomes exhausting trying to get all of those things in line while still supporting your child who has significant healthcare needs. And then that mixed emotions, again, just that tug of war back and forth of feeling hopeful one day about your child's prognosis and really living in the moment and enjoying it. And then the next morning waking up and just being paralyzed by fear of what's next, and just feeling like how those feelings change so rapidly within minutes, and being in so many different spaces becomes quite challenging. Next. So now I'm going to talk a little bit more about anticipatory grief within the different informants. So within the child who has the illness, the siblings, and the parents. Usually when we're thinking about the child who has cancer, one of the biggest things that we hear from patients is anxiety about separation from family. And this is often the questions about, what will death feel like? What does that mean? And just worries about no longer physically being present with the people that they love. We'll talk about later in this about how to have more open and honest conversations with children about their illness and their prognosis. But what we know for kids is oftentimes if they're not presented that open space to really talk about the things that they're worried about and the things on their mind, that makes them feel more isolated. And oftentimes kids may worry about things even more. It kind of makes their thoughts even scarier if they don't have the opportunity to really process through those. And so, as we'll talk about in the future slides, ways to facilitate those conversations so that children feel they have the trusted space to talk about these hard topics. Next. This is a study of siblings in pediatric oncology, and I pulled a few quotes because it was a qualitative study, and I really think these just highlight some of the big things that our siblings are experiencing through their anticipatory grief process. The top one here says, since he's sick now, it's like you constantly want to be with him because you don't know when he is going to get sicker. And that really, again, kind of talks about, which I think some of our families reference, of life feels almost like a ticking time bomb of trying to make every moment count and everything to be perfect because you don't know how much time you have left. We have two here that kind of talk about not only do they feel like they're losing their sibling to their illness, but also losing their parents because parents are very busy taking care of the child. I feel lonely because basically they're helping my sister and they're not helping me. They hardly cared about our lives. We lost our parents too. And then also some of the, as we talked about, change in identity, right? When we are presented with different stressors, sometimes we might change our personality because we're so bogged down by all of the stress. So one child says, you just keep thinking about going home to see someone like sick every single day. So you kind of act differently, or you're more quiet, or you keep things to yourself instead of being outgoing. And then I appreciate some of these quotes here on the right that, again, really talk about anticipatory grief, and they really show the power of it. It is the moment that they hear the word cancer, it's the moment they hear the diagnosis that these big feelings start. So just when we got the diagnosis, I felt that I started to grieve, and there was a chance that my brother would not be staying with me. The doctors told us that it was cancer, and in my years, it was the same as death. Next. This quote right here for anticipatory grief in parents is from the textbook Interdisciplinary Pediatric Palliative Care. And I think, again, it was a beautiful description of what a lot of our parents express feeling. The mom says, "I can't understand why I cry all the time. My daughter is doing reasonably well. It makes me feel guilty when I cry like this. I feel as if I'm burying her before she actually dies." And I know I mentioned that earlier, but just those constant feelings of that physical rehearsal of death and feeling like you can imagine how difficult that would be. And then again, that back and forth as you're trying to remain present while still having a lot of these fears. Below the quote is from a study. It was a study of parents whose children were either newly diagnosed with cancer or were diagnosed 6 to 12 months before. And it showed that fewer than half of the parents reported being at peace and talking about, again, how a lot of them were impacted negatively with their quality of life and psychological functioning because of anticipatory grief. And then it showed that parents of newly diagnosed children reported more severe anticipatory grief. And as providers, I think that's really important for us to know that, again, from the get-go, having psychosocial supports involved so that we can help families navigate all of the novel things, getting comfortable with the hospital setting and all, processing all the information and facilitating positive coping and being involved at the front end is so powerful, knowing that that can be one of the most stressful parts. And then as a provider, building that rapport. So depending on how the illness progresses, that they have trust in these teams and can refer to us for support. Next. So we've talked a lot about what anticipatory grief is, what it can look like in patients and parents and siblings. But I think the really important thing is how do we cope with this, right? And how do we support parents, siblings, and patients through this? And I think there's a variety of things that us as providers can help facilitate, but also for families of things that they can practice at home and talk about with their child to help facilitate coping with these difficult diagnoses. So one of the most important things, which I think is a theme through all of the next slides in terms of talking about coping, is creating that safe space to talk about this and giving a name to the feelings that we're having. So oftentimes when we talk about grief, again, it is that emotional roller coaster that we're experiencing. And so I think grief, again, is a wonderful word to capture all of the words and feelings that people are having, but providing that space where we validate and that it's normal to feel a variety of emotions and for that to go back and forth minute by minute. Finding your support systems is a big one. And one of the things that I think is important and why it's so helpful to have these psychosocial supports involved, if possible, is that sometimes when a family is presented with a stressor like this, they may all be coping differently. They may all be grieving differently. And again, there's no right or wrong way to grieve, but when we grieve differently, sometimes that can add extra conflict within the family system, especially if there's different goals of care. And so it can be helpful to have that unbiased space to truly be able to have that space where you can talk about all of the feelings and thoughts you're having and have somebody to listen and validate and be able to provide supports. Journaling is another way. If you feel like talking out your feelings is really difficult, it can be a way to express yourself in writing. I've heard a lot of parents sometimes write letters to their child as if, if their child's sleeping and they're in the hospital room, like writing things that they want them to know. And those can be different letters that they give to their child at different time points in their journey. But again, a way just as self-expression that doesn't involve talking to someone, which can sometimes be more comfortable. Other relaxation strategies such as guided imagery and mindfulness and meditation. I often talk in terms of like mindfulness and meditation. Families have talked about in terms of describing their anticipatory grief. It's like they're in a movie theater with the worst possible outcome and they can't get up and they're stuck in the seat. And again, all they can see is walking through that child's funeral or burying their child. It feels like a nightmare of a movie that they can't get out of. And using some of these strategies to find the courage to walk out and leave the theater and walk into a different movie. And whatever that looks like, whether it's, the next day and they're going to go to the park and enjoy their favorite ice cream, or if there's other future goals, but trying to find ways of the time that you have left with your child, what movie can you then walk yourself into to support your child and enjoy the time that you have together? There are hospitals and other approaches that offer the integrative therapies, which I think, again, can be really helpful in facilitating relaxation and coping, but also expression, which I think, again, is really important, being able to talk about what you're feeling as you're going through the anticipatory grief. So whether that's through art, if it's massage, music therapy, spending time in nature to feel more grounded, all of those things can be really helpful. For a lot of our family, spirituality is another part of coping. And I think one thing to mention is that sometimes with some of the anticipatory grief, as we talked about before, we might hear families talk about being angry with their higher powers for putting their families through something so difficult. And so again, as providers, being conscientious of this so that we can help support and provide any religious supports that can help walk families through that if that is something they're experiencing. And then these last 2 points are things that I talk about all the time with our families, is practicing forgiveness and self-compassion and grace. Always, in talking, we're all human. None of us are machines. And so this is, when you're presented with this is truly an emotional marathon. This is a roller coaster of emotions. It's exhausting. And so there's going to be times where you might accidentally snap at your child and you did not mean it. There's going to be times where you don't feel like getting out of bed. And there's going to be times where you just feel upset that you're sitting in the hospital. And that is okay to feel that. You can have those feelings. And so the goal is, again, to provide the space and then try to find the thing of, again, what is the next thing that we can do? What is in the next minute? What are your values? What is important to you? And how can we move you towards doing the things that are most meaningful to you and your family while giving yourself the space to process all of the hard? Next. So some reminders I wanted to include, and I feel like I've talked about these a little bit throughout some of the other slides, is the reminder that everyone grieves in their own way, and there is no right or wrong way to grieve. I always talk about grief as like a fingerprint, so it's unique to each of us. And so all of us are going to have our own styles. And when we think about a family system, again, between siblings and parents and the child with the illness, they're all going to have their own approach. And so as we help support them as a team and how families support one another, of recognizing where's kind of that middle area where we can all be together to support one another, and recognizing and learning from each other what each one needs, because what brother needs might be different than what mom needs. And so how can we recognize that and be able to support that within the family? And then in terms of anticipatory grief, a big reminder is feeling grief while your loved one is still alive does not mean that you are giving up on them. And that is a reminder that I hope that families can take away and whisper to themselves when they start to feel guilt. And it's not about giving up. It's about all of the grief and the losses that you've experienced. And it's normal, because grief is the response to a change you didn't ask for, and you didn't ask for any of these changes in your life. And they're hard. They're significantly impacting your quality of life. And the reason why it's so hard is because you love your child so much, and you're trying to find ways to give your child the life they deserve with the time that they have. Next. One of the big things, as I had talked about, of something we want to monitor is disengagement. And that's because we know that for a lot of families, focusing on precious time together is one of the most powerful coping strategies they have as they're navigating their anticipatory grief. And so these are just various ideas that can be really helpful in supporting and facilitating that family time together. So one thing I often talk about with families is making an I wish I could list, and then kind of breaking that down based off how much energy the child has. As we know that with a lot of our neuro-oncology diagnoses, they can significantly impact energy. And so having different ones, because sometimes when we're feeling like we have low energy, it can be hard to come up with ideas of how can we have fun and enjoy time together. So trying to find ways to do that and make it easy. Having your child pick out a gift for someone they love, that can be really powerful. The gift of being able to give a gift and have something meaningful for the child, that helps empower the child when they've lost a lot of other things in their life. Recording, I always encourage families, record cute or funny things you're saying in the hospital, pictures, videos, because those are the mementos that are so meaningful. I always hear from families of like, oh, like that one day, like I wish I would have remembered what he said when we laughed for hours. And so just having a notebook or typing in your phone things they say that you feel like are really powerful memories are important, because those are things that are really comforting long term. Reading books, making scrapbooks, all of the legacy projects such as like hand molds and heartbeat recordings, all of the things that can help you feel connected to your child. And then another thing, like discovering new things about each other. I've always heard with kids, like they love to hear about when they were babies and things that they were when they were mischievous and things they got into, and just things that they may not know, or even when their parents were kids, stories they may not know about them, but it's a way to feel bonded and to learn more about each other. And the last thing I'll say about this is sometimes precious time together is simply sitting in silence. And there is nothing wrong with that, because just the ability to be together and be present with each other is also powerful and comforting. So if you're not doing an activity, it's still valuable for you to be together. Next. So this next part of the presentation is really focusing on how we can support the child who is dying with our open and honest conversation. So the first thing I want to highlight is sharing feelings is okay. And it's really important actually to model emotions, because what that shows for our children is it's okay if they're feeling the roller coaster of emotions related to anticipatory grief. Seeing somebody else model and express those gives them permission that it's a safe space and it's okay they feel that too. It's a little bit of normalization that we're all feeling this and we're all riding the waves along with this. And then in terms of preparing children and following along with their lead, we often talk about using comforting, honest, and developmentally appropriate language to tell the child and the siblings that sometimes children do die of their illnesses, and which we'll talk about in future slides. Next. So just a very brief explanation of developmental considerations of understanding processing death. So the first one in our infants, this is 2 to 6 years old. Between 0 and 2, we know that there is not much of an understanding of death. What they tend to notice most is just differences in caregiving patterns. But between 2 and 6, they often do not understand permanency or irreversibility of death. So in terms of permanency, not knowing that, feeling like somebody can come back after they've died, or an irreversibility, feeling like, again, somebody can come back and it's not something that's going to be necessarily permanent. Usually kids at this age are most worried about leaving you. So as we talked about, so that separation, anxiety, distress, what it would be like to not be physically present with their loved ones, and then not necessarily knowing where they go, if it's a strange place, what that will look like. So those might be some more questions that they would ask. As they get older into school age, between 7 and 11, that is when that starts to shift their understanding of death. So then they do start to identify that death is permanent, it's irreversible, and it's also a universal thing that happens. One of the hard things, I think, when we're talking about, these are just general developmental considerations, it is really hard to explain to a child why a child has to die, though, as we know that it goes completely against the natural order of life. And I think that facilitates a whole different conversation, but I want to highlight that here because I know that is not a universal thing, that children die from their illness. And then with adolescents and young adults, oftentimes they will be more worried about how their death will affect their loved ones. So they might be asking about parents and siblings and how they'll do without them in their lives. And then because developmentally identity and independence and a sense of control is so important, those are the areas where you might start to notice that death has become a bigger stressor for them in terms of finding out who they are and who they can be with the limited time that they have left, and the ability to assert a sense of control when so much has been taken away from them. Next. So the first thing I think when we're thinking about how we can prep children, but also respond to their questions, is just us listening. Listening is such a powerful intervention. And so I encourage families and providers to really monitor hints from children. Listen very closely to what your children are saying, because oftentimes they may be saying something and they're simply planting a seed, and they want to see how that caregiver or that provider responds to them, and if it's a safe space to further that conversation. So here are just a few examples. You might hear your child say, I'm going to go see my grandma soon, and maybe grandma died last year after having an unexpected heart attack. Or if my medicine stops working, I'm going to go play with Jesus. Or when we think about as we prepare for a new school year, or things that they typically do in traditions, I don't need a new book bag, I'm not going to school next year. You might hear other ones say, I'm tired and I want to go home, or I'm not afraid to die. They might come out and just use the death word, the death and dying. But these are all things that kind of show that this topic is on the children's mind. And so for us to be able to respond and provide that space to process whatever worries and concerns they're experiencing. Next. Oftentimes when I'm talking with families and we're talking about having open and honest conversations, the most common thing I hear from parents is, what if my child asks, am I dying? And that's one of the scariest questions to answer as a parent. And it's something that no parent ever expects to have to answer in their lifetime for a child. So here's just a sample response. That is a good question. I do not know yet what is going to happen next. The medicine you were taking is no longer working on your cancer. Sometimes children do die from cancer, but I do not think this is happening right now. We are working with your doctors to find another medicine for you to try. I will let you know if anything changes. Remember, I'm going to be with you no matter what. And there's a few really important things that I like about this response to the question of am I dying? So one, we're validating, like, please continue asking these questions. I appreciate you coming to me when these questions come up. There's a lot of honest information here, such as, Your medicine is currently not working, and we're talking about the plan. We're giving them information. We're still talking with your medical team. Are there other options for medicines that you can take to try to fight your cancer? And then also at the bottom, letting you know if anything changes. So that is a really important statement to add, because it reassures the child that right now, I do not think you're dying, but if that ever changes and we realize there are no other medicines to use to treat your cancer, I will let you know when there is a change in your illness journey. And again, that just provides that safe atmosphere. And then most importantly for children, just knowing that no matter what happens, that the people that love them the most are always going to be there with them. Next. So a similar question you might get from a child is, will I get better? A couple responses when children ask that is, sometimes no matter how hard everyone tries, the body can't be fixed. And that's a little bit more of, now you've responded, you've planted a little bit more seed, you've furthered a little bit what they say, and kind of take the lead of where they're going to go with next. No one knows for sure. What do you think about that? And I think that this is a really good approach. A lot of these questions and talking about death and dying, we don't have the answers to. Nobody can always be 100% positive of what happens in some of these situations. And so allowing the child to sort of like, what are you thinking about? What's on your mind? It's always okay to ask your child. Sounds like you may want to talk about what can happen if you don't get better. And that is, again, it's more of like a permission asking. Do we want to talk more about this? Is this a good time for us to open up this difficult discussion? And I've been thinking about it too. Shall we ask the doctor to talk to us about that? And that's, again, insinuating maybe we call the oncology team or the palliative care team and different teams to help support some of these conversations. Next. These are just some potential questions from children that we might hear who are dying. And I think, again, there's all of these answers and responses are going to look different based on cultural considerations and spiritual considerations and what families are comfortable with. And that's why when we're talking with families and helping them prepare for these difficult conversations or helping to facilitate them, I always tell families there is no like one size fits all approach. There is no roadmap how you do these things. And so the goal of this is for us to work as a team together, find out what parents are most comfortable about, what fits within their family system and their cultural system to help answer all of these difficult questions about death and dying. Next. In terms of helping to empower the child who is dying, one thing, when we have open and honest conversations, that really allows us the space to help the child, give them an opportunity to plan for their death. So there's a lot of great planning guides out there, such as Voicing My Choices, My Wishes, and lots of really developmentally appropriate that start to talk about some of these difficult concepts. So in those planning guides, and you might hear children start to talk about things that they want to wear at their funeral, or maybe special toys that they want to give away to people that they love, or the music they want to play at the ceremony. Giving them the choice when they're healthy enough to make the choice. Would you want to die in the hospital, or would you rather be at home? Are there things that you would like to do before you die? And again, if we're able to be more open and honest, it allows that space to talk about those hard things, but really to allow the child the opportunity to make the most of their time and to have choices in a situation where they've been presented with very few choices. And then most importantly, we always talk about telling your child that they will always remain a part of the family. They'll always be loved and they'll never be forgotten. I was actually just talking with a family yesterday. The mom was like, I'm just trying to come up with a positive mantra that I can keep saying to my daughter to let her know that I will always love her, and that no matter where we are, that my love will always follow her. And so that's what she ended up landing on, of my love will follow you wherever you will go, which I thought was truly beautiful. And I think that can come up of, when you're at a sleepover, my love for you is still there. When I look at a picture of you, my love for you is still there. And trying to talk a little bit about, even if you're not physically present, the love is very strong. And so is that family connection. Next. In terms of supporting siblings, a lot of this is similar to what you would do with a child who is dying. So validating and normalizing emotions, using open and honest language. One big thing for siblings, and honestly the children who also has the illness, is explaining emotions in family. So again, let's say, for example, you're having a really bad day and you might accidentally yell at the child because you just have a low frustration tolerance today. You've got some really difficult news and everything is feeling very heavy. To then take that time, first give yourself forgiveness. This happens, you're under a lot of stress. And then also finding that time to debrief with the children and explain, mom was feeling really, really upset because she heard something really difficult from the doctor today about Joe's illness. Or if maybe mom and dad are arguing, being able to say, we're both really stressed right now, and being able to explain those emotions. When we're angry, it's not at you, it's not anything that you've done, but right now we're feeling really stressed and our cup is feeling quite empty. So just to kind of help when there's all of these new emotions in the home, kids don't always know how to respond and it can feel very overwhelming. But when we express an emotion, we may not always be proud of what that emotion looked like, and that's okay. But giving ourselves forgiveness and then having the opportunity to explain that emotion and what are some things that might have triggered those emotions and ways that they can work together as a family. Including siblings in the care as desired. So some siblings really want to take an active role, and I think that that is something great to offer them. Connecting to their lives, so asking them, did you have fun at that birthday party? Did you win your football game? And that just really shows children that even though that this family is faced with insurmountable obstacles right now, they still care very much about the child who is doing the normal activities and being able to balance both the worlds of medical care and the normalcy activities of siblings. Finding times of joy, when we think about the control piece again, letting children know there's a lot of aspects in this that we don't have control over. We don't have control over if the tumor grows. We don't have control over if there's additional treatments to be created. But what we do have control over is how we spend our time together as family. So what are the fun things we can do? How can we make the most out of the time that we have together? And then connecting with siblings outside supports. Oftentimes that's school, it can be coaches or community organizations, but making sure the siblings have as much support as possible. Next. And then as a parent and caregiver, we talked about this a lot, but again, forgiving yourself and knowing that you were a good parent to your child with cancer and their siblings. This is a really big piece for our healthcare providers. And when I'm seeing families, I always try to remind parents, even from time of diagnosis, all of the coping strengths they have, all of the wonderful things that I've seen them do in terms of supporting their child and balancing care and the a million other life responsibilities that have been presented to them. And the goals, I think oftentimes we're always really hard on ourselves, right? And it can be really hard to see that light as a parent. So how do we, kind of the outside people who are supporting them, call out the wonderful things that they're doing and the love that we see between them and their child and how much their child loves them and appreciates them, because those are the powerful things that they'll remember. Next. And then lastly, a little bit talking about benefit finding. So things about growth areas when we're presented with adversity related to anticipatory grief. Acknowledging anticipatory grief and finding that space really gives families the time to slowly adjust to reality that the child or the sibling will die soon, right? So acknowledging those emotions and having that preparation gives them the space to do that. It gives them the space to learn and develop coping skills, recognizing that a lot of emotions they're feeling now may be similar ones they would feel after the child died, and the intensity and frequency may look different, but being able to have that time together to learn those skills. It gives you a chance to finish something that you wish to complete with them. So again, I think this is all about time, right? With the time that you have left, how can you make it most meaningful for your family? Is it, going somewhere really fun together? Is it taking lots of pictures and videos? Is it simply cuddling up and having movie nights? Is there an art project that you want to complete with everyone's handprints? Like, what are those things that are going to hold the most value? And none of those will ever replace the physical presence of your child's life, but again, gives you a way to commemorate all the special memories that you have and gives you something to hold on to. It gives you the chance, when we're open and honest with each other about hard times and we're vulnerable, it strengthens our relationships with other people. So oftentimes hard conversations make us closer to the people that we love. And that can be a truly valuable part of experiencing anticipatory grief. It often has us shifting priorities, right? So things that used to make us really upset might not even matter anymore. And we really find out what are the true things that give meaning to our lives. What do we value most? And we always kind of talk about when someone is presented with an illness, like we live so much differently. We're so much mindful. We're grateful for the small things that honestly, a lot of us who aren't presented with the illness probably take for granted oftentimes. And so how do we again all live and find the meaning that we need to in our lives? And then there is some evidence to show that there is reduced intensity of grief following death if people are, acknowledging and experiencing anticipatory grief and using their coping strategies. The evidence is mixed, but there is some that shows, again, that when you're processing grief and giving a name to it and using strategies, that it can help reduce intensity as a bereaved family. All that to say, I think and finding growth that is helpful coping, while also acknowledging the space that this is a very difficult experience. And so again, my final thought is the way that we can help families bridge and find meaning together and make their time count as they spend their time together in coping with this illness. Thank you.
Thank you so much, Dr. Schaefer. I took a page and a half of notes when we were talking. Such valuable information and a conversation that I don't think is often had. I'm going to jump right into some questions we had at registration. For all of you on here today, please feel free to put your questions in the Q&A down at the bottom here, but we do have some that came in from registration. One of the first ones, we have quite a few healthcare professionals on here, and the question came up of how might one navigate situations where the children are ready to process their anticipatory grief before the parents are?
I think that's a great question, and honestly a situation that happens pretty often. One of the things and approaches that I like to take is when we're having like individual time with children. I didn't mention this in my presentation, but sometimes when the provider is one-on-one with the children, we might get different content of conversation. And that's oftentimes because children may want to protect the people they love, and they may not ask some of those hard questions. And so in those one-on-one conversations, I'll use those behavioral observations and the seeds that the children are planting and ask permission for the child if I can share them with their parents. And usually in terms of facilitating that conversation, I'll ask for permission for the parent to share some of the information that I received from the child, and then follow that up with sharing my concerns of, I think there's a lot on so-and-so's mind right now. I wonder if they're worrying about a lot of things, and feeling like they're alone with some of these worries. Like, what are your thoughts about that? What do you think that we could do to be helpful? And I feel like if we leave it open and use permission, asking, and then share our worries and concerns of what we've seen with a lot of other families, one, it normalizes the experience, but it also helps open the doors. And I think when we talk about we normalize, this is hard for a lot of parents to initiate these conversations, but it gives them grace that it's okay that it's hard, and we're here to help support those conversations. Oftentimes I find once we kind of give those specific behavioral observations of what the child is saying, that helps the parent feel more comfortable of, yes, they are planting those seeds because they do want to be able to have these conversations with us.
Great, thank you for that. The next question comes from one of our parents, and you talk quite a bit about supporting the sibling and the patient and watching for different signs and different reactions. But this question is, what are the first steps to bringing this up with my family? What does that look like on the initial onset of a parent or caregiver wanting to talk to their family?
Yeah, I think that is a great question. Timing is something that I've thought a lot about with these difficult conversations. As I mentioned before, none of these are like cookie cutter approaches. And so it probably is unique and dependent for each family system, depending on what's important to them and how they feel like they can best support their family. I find oftentimes, whether that's a psychosocial provider or even a medical provider, us educating families on what to expect in terms of coping and what we see a lot in other patients and families gives family permission to talk about these hard things. It doesn't make them feel like it's something unique about them, but that this is a common part of the cancer experience. And so I think providing some of that education at those initial visits of, these are some things we've heard from patients and families, and we're people who can walk alongside you. And then oftentimes coaching parents and caregivers about, these are some common topics that we hear from patients and siblings. And then having that collaborative conversation of, what do you think that might look like to have that conversation at home? Would it be helpful to have it all together? Would you want to have one-on-one time? What might be for one child who maybe isn't verbally expressive, would it be getting a journal out and just saying, like, draw a picture of what life has felt like in the last week? Or is it sitting your adolescent down and saying, reminding them that you're here, and what questions do you have, and creating a question box so they can just drop worries in. So again, I think it looks very different for families, but to facilitate that, I think as providers, it's really important for us to normalize and provide the anticipatory guidance of what a lot of families experience. If we give the name of anticipatory grief and what that looks like, it allows the families to open those conversations and then have them in the home or have them in the hospital with the support of psychosocial providers, child life specialists, psychologists, social workers, counselors, chaplains, people like that who can help assist those conversations.
I think the one phrase I hear over and over is just allowing the permission for the families to have their own individual anticipatory grief and their own individual timeline, but really just allowing that space is so important. And I love that. I just love this conversation today. I do have a question that came in on the Q&A, and I'm going to generalize it a little bit because it's actually one that Jen and I get quite frequently here from families or other providers. And maybe you have a secret sauce, I'm not sure, but
I hope so.
The question is, how can I find the right therapist to help child, parents, and other family members?
Oh, can you repeat that? Sorry, cut out at the very end.
That's okay. How can I find the right therapist to help children, parents, or other family members?
That is a great question. So a lot of us here in children's hospitals are identified as pediatric psychologists, and pediatric psychologists, our specialty is helping families navigate chronic illness, grief, anticipatory grief, losses, those very medically minded stressors. And so anybody who identifies as a pediatric psychologist often is going to have that skill set within chronic illness and medical stressors. So that's like a good overarching name of people that you're looking out for. I often look for people who are, also trained in grief counseling, right? And whether that's using like cognitive behavioral therapy strategies or acceptance commitment-based strategies. So you might see the acronym CBT or ACT, ACT, different types of evidence-based strategies we know to help support grief. But I do think oftentimes connecting with your social workers or your medical providers who again are seeing a lot of these families, that is when I'm making outside referrals, usually they're people that come highly recommended from other families I've seen. And so asking your providers, because a lot of them will learn about that. And when I hear a family say like, I'm seeing so-and-so and they've been excellent, I have a list that I keep and I keep that whole list. But I do think connecting within your children's hospital to the people who are supporting you can probably help you find people in the region or the network who are trained to navigate anticipatory grief and grief in the context of medical illness.
Thank you for that. I am going to ask one last question. As I mentioned, we do have so many healthcare providers on here today. And one of the questions that came in was, what is the best way to support not only the patient families, but also the team members who are caring for these children?
I love that question. It's something that I think about often in my role. I think when we think about the sustainability of us as a field, it is really important that we find ways to fill our cup up. And one of the things, as Jen had mentioned in my introduction, is I'm really interested in meaning making. And I have found that to be a very powerful therapeutic intervention, one that we talk about with patients and families, but also for myself. And that can look like, narrative medicine has become a very hot topic, right? Using literature and poems and readings and songs to find meaning in the work that we do. But a lot of it, just as we talk about when families are experiencing grief, memory sharing and storytelling and ways that we find the opportunity to be connected with the person that has died or the person who is very ill, I think is incredibly important. So I'm happy to share what I do as a provider. So when I have a patient who is dying or has died, I often try to remind myself of what are the things that really stick out to me about this patient? So is it like a movie that was on nonstop when they were in the hospital? Maybe I'll go home and watch that movie. Or sometimes I'll ask myself, what would be something that if this child had all of their functioning, what would be something that they would really want to do? So I might go do that in memory of them or in honor of them, of something that they would want to do. Usually I also often think about what lessons did this patient and family teach me, and how can I be a better psychologist because of what they taught me? And that helps me because let's say I walk into another room where there's a similar coping challenge, in my mind, it's like, so-and-so taught me this. They taught me that this is how, in this situation, this is what helpful. And then I can share that with them. And I feel like that honors their legacy and it allows them to continue living on for many patients and families, but it also helps me still feel more connected because they're helping me be better. They're right there alongside me, helping to support families. And then additionally, I think when we have opportunities, if there's memorial services or there's like hospital-wide remembrances, those types of things where you can see families again and share your favorite stories and appreciation for allowing you to witness the extraordinary life of their child are the things that are most healing for me as a provider.
Thank you so much. I just want to, again, express our gratitude for you taking the time today and putting together so many practical tools, sharing your expertise and your experience with us. Thank you also to our attendees for your participation and your thoughtful questions. We're glad you were able to be here with us today, and we hope that you will share this with a family, a friend, a colleague. The PBTF is here to support you no matter where you are in your journey. So reach out to us for support at the contact information on the slide. We will be sending a link to the recording of the webinar in the next week. Today, you will get an email from me with the slides from the presentation and a short survey for your feedback. So thank you all so much and have a wonderful afternoon.
Thank you.
Bye.